kini tak lagi menjadi penyakit yang asing bagi kita. Penyakit ini seringkali menyerang orang-orang di usia lanjut. Namun tidak menutup kemungkinan stroke menyerang pria atau wanita di usia muda. Ada berbagai macam faktor yang menyebabkan seseorang berisiko tinggi terserang penyakit stroke. Lalu apakah COVID-19 bisa memperburuk kondisi seseorang yang memiliki faktor risiko stroke? Apakah ada hubungan atau pengaruh yang kuat dari COVID-19 terhadap stroke? Temukan jawabannya dari penuturan Dr. Chou Ning berikut ini.
Thank you. Good afternoon, everyone. I must thank Pak Christian and Pak Awin who helped organize this webinar on stroke, and the correlation of stroke with COVID-19. Why is stroke important to us? Stroke, as we know, is the 5th leading cause of death for us. And depending on the hospital you go to, general mortality, the chance of dying in the hospital runs between 30 to 50%. 30 to 50%. And of those who survive, half are disabled. That means they are not able to go back to work. So this is very important for people who are affected by stroke. It is important to know that the risk factors are same as those for the heart. And worldwide, it is shown that prevention strategies to prevent stroke has resulted in 42% of stroke incidents in high-income countries. So this is important to know that stroke is preventable. It is preventable. So what is stroke? To put it simply, stroke is a cerebral vascular accident. There's an interruption of blood supply to the brain. 80% is ischemic and 20% there's bleeding. Let me explain. For the 80% who are ischemic, the blood doesn't flow because there's a clot inside formed by cholesterol in the neck vessels and the brain vessels. And there's embolic clot, where the clot comes from the heart or from the neck and blocks the blood vessel in the brain. What's the end result? End result is there's deprivation of oxygen and the brain will die after 3 minutes. Now this is a scan of the brain. You can see the blood vessel is white in color. The white in color shows that there's a blood clot inside this middle cerebral artery. This scan is done in the first few hours of a stroke. And about 12 hours later, you see the whole area has turned dark. The area of the brain has become infarcted. So, but on the other hand, a hemorrhagic stroke whereby there's a bleeding in the brain, there's a blood clot, and if the clot is small, the clot will resolve by itself. But if the clot is large, then surgery will be required. This is a scan of a patient with a large blood clot. And because there's a large blood clot, we do surgery, we remove the bone, we go inside, take out the blood clot. This is a post-operative scan, right? The clot is removed. So, how do we recognize a stroke? We recognize a stroke when there is weakness, numbness of the body, or speech is lost. Suddenly the patient cannot talk. Or the patient complains, suddenly one eye cannot see. Or the face starts to droop or drool saliva. Or speech, the patient suddenly say, oh, he cannot talk. So whenever we see this numbness, weakness, loss of speech, loss of vision or saliva, this is a stroke. What do? It is very important that the patient immediately goes to a medical facility whereby a CT scan is done. Why is it important? because majority of the strokes are ischemic. And if we can get to the hospital within 4.5 hours, 4.5 hours, the doctors can give intravenous TPA. What is TPA? It's tissue plasminogen activator. This basically breaks down the blood clot that's formed inside the blood vessel. And if this doesn't help, within 2 hours, we can, the radiologist can put a catheter and remove the blood clot. Now, important is that it must be within 4.5 hours. Now, if this is possible, then the patient can have a good recovery, So it important is that the time frame is 4.5 hours, must rush to the hospital. And if the patient has got no brain tumor, no previous hemorrhage, then the doctors will give tissue plasminogen activator. You must have no head injury before, the blood pressure must be controlled to less than 185 millimeters and a platelet count of 100,000. So what is the outcome? The outcome is that if you are given this tissue plasminogen activator, 53%, more than half, will have a good outcome. They can walk, they can perform the fun activities of daily living, they can eat, they can feed themselves. So this is important. And after 1 year, 40% have minimal deficit. That means they are back to work. So it is very important that the patient goes to the hospital within 4.5 hours. Now, this is the window period. You can see this, right? Yeah. So for what if the patient gets to the hospital after 4.5 hours? Then if they go after 4.5 hours, then you cannot give the tissue plasminogen agent. It's after the period. And then we need to do surgery, remove the bone, put a catheter here. You see the tip of a catheter here to drain the brain fluid, to lower the pressure inside the head. And this is, if the large ischemic stroke, the patient will need decompressive craniectomy. That means removal of the bone to relieve the pressure. On the other hand, if it is a hemorrhagic stroke where there's bleeding, again, you must go to the hospital, immediate scan, and for urgent life-saving surgery for large blood clot. But in these kind of cases, the neurological deficit has occurred and surgery is only meant to save the life rather than recover function. So this is for hemorrhagic strokes. Example, for small little blood clot, you leave alone. No surgery is required. But for big blood clot, again, you remove the bone and you remove the blood clot. These are examples, right? So big blood clot or surgery. Small blood clot, you leave it alone. Now, so why do we screen? We screen for strokes because stroke can happen to anyone, anywhere, anytime, and prevent a devastating outcome. Why? Because 30% will die. And of the 50% of patients who survive, 50% are disabled. And what we want is that we want to prevent stroke so you can maintain to have a good quality of life. And we have proven that screening have resulted in 42% decrease in strokes. So screening does work. So, and it prevents stroke before it happens. Therefore, it is important for everyone to go to the doctors, to go for screening for stroke, to control blood pressure, control diabetes, control your cholesterol, and control your cessation of smoking. So again, this is again how to approach. 80% we can be prevented, is preventable. What we can do is we can scan the brain. We can look at the blood vessels in the brain. We manage the cholesterol, we exercise, stop smoking, and the BMI, right? Those above 30 are at risk. So to prevent ischemic strokes, we look at the blood vessel, control cholesterol, control diabetes, high blood pressure. These are very important factors. And we can give the patient antiplatelet agents like aspirin or Plavix or DOACs. These are the newer anticoagulation agents that the doctors can give for the patient. Prevent hemorrhagic stroke, the most important is to control blood pressure. Again, you control the cessation of smoking, and the blood vessels will prevent to the angiogram. You can exclude aneurysms or abnormal blood vessels inside the head. These are important. So, stroke prevention. Now,
Audio Jungle.
of importance, there are certain patients who are at high risk of a stroke. High risk. So patients with transient ischemic attack. What is a transient ischemic attack? It is a patient who says that he has got weakness or numbness with loss of vision, but recovers within 24 hours. These patients, when they go to have this, they must go to the hospital immediately. Why? Because the risk of stroke is between 2 to 17% in the first 3 months. And within 6 months, 1/3 will have a major stroke. So anyone with a temporary weakness or numbness or loss of vision must see a doctor. High blood pressure, diabetes, BMI of greater than 30. All these are high risk factors of stroke. The other group of patients are those above the age of 65, those who are smoking, which increases ischemic strokes. The more you smoke, the more you have a stroke. So important. Even vaping, right? The electronic cigarettes is also associated with high risk of stroke and heart attack. High risk patients must be screened. So this is again an explanation of the transient ischemic attack. This is basically a mini stroke, whereby the patient has got neurological deficit, weakness, but resolves within 24 hours. This is a transient ischemic attack. Other things like hemorrhagic fugax, which is temporary blindness, like a curtain covering one eye. This arises from platelet emboli, which is either from the heart or the blood vessels. Basically, all these high risks of stroke, right? You must be investigated. Now, the next thing is high blood pressure. High blood pressure is known to be a leading cause of stroke. We must control the systolic blood pressure to 140 or below, because this blood pressure puts the arteries under constant stress. It damages the arterial walls and makes them weaker. So we must look after all our patients, control the blood pressure well. Cholesterol is also another high risk factor, because it increases the stroke, because it causes inflammation caused by the cholesterol plaques. Because the blood flow and the increased blockage, it gives rise to transient ischemic attack. So what the doctors must do, you must manage your cholesterol, manage the bad cholesterol, which is your LDL. All these can be controlled with medication, with exercise to increase your HDL, right? So you must watch your cholesterol and LDL levels. Diabetes is known to increase stroke risk by 4 times. So therefore, because the high glucose level, hyperglycemia, high glucose level damages the small vessels and damages the large vessels. So basically, we must control the sugar well. Obesity is associated, but it is more an association with men. The risk of obesity and women is less strong. Of course, other ways to measure waist circumference, waist-hip ratio are all the factors which the doctors can use. Most important, you must keep the waist circumference less than 40 inch and BMI of less than 30. So this is stroke. But today, we also want to look at how does COVID affect the brain. How does COVID affect the brain? These are the few things that can cause, like encephalitis. That means inflammation of the brain itself, right? It can cause loss of smell. It can cause inflammation of the membrane covering the brain. All these are associated with life-threatening condition. There's ADEM, which is acute disseminate encephalitis. This is very rare. Guillain-Barré, which is an autoimmune disease, which is also very rare. And of course, acute cerebrovascular disease, and this is stroke. Of all this, the most important here, the most common is basically stroke. So how does COVID spread to the brain? COVID spread to the brain by going up the nose, up to the thin bone, or through the olfactory bulb, which is the nerve fibers for the nose. So that is why you hear people say, when you have loss of smell, think of COVID. It can also go via the blood, goes by the blood and goes through the brain tissue. And basically it goes to the angiotensin converting enzyme 2, right? It then affects the glial cells and induces the cytokine storm, right? So IL-6, interleukin 6, interleukin 2, all these causes the inflammatory response within the brain. But for all of us, it's just enough to just know that it goes through the nose and go through the blood. That's how it spreads to the brain. So how does it affect stroke? Increases stroke risk, no doubt about it. Increases stroke risk, both ischemic and hemorrhagic. And 19 are prone to develop blood clots inside the small blood vessel and via the immune response, right? Immune response. So let's talk about hemorrhagic stroke. Basically, the at-risk patients are, again, those with high blood pressure and with diabetes. Again, we talk about the angiotensin converting enzyme 2, and also it causes the release of cytokines, increases the incidence of hemorrhagic strokes. Not common, but it does increase. These are the things that the doctors will really check for: the D-dimer, the platelet count, the clotting factors, and these are indicative of increase in lack of ability for the blood to clot. Now, ischemic strokes. This is probably the most common and important factor for COVID. It increases by 8 times. And again, the at-risk population are those with high blood pressure and diabetes. But you must remember that this COVID strokes affect the younger age group, as young as 30 years old, right? So the more important ones are the ischemic strokes, and data also shows that those in the Afro-Caribbean population, those are more affected in Africa. So ischemic strokes are, again, you must remember, is 8 times. The mechanism is inflammation and cytokine storm. So these are the keywords: inflammation and cytokine storm, and causes the induced endolytis, which is inflammation within the blood vessel itself. Now, this is meningitis. Meningitis is quite rare. It involves the inflammation of the brain, the membrane around the brain. Of course, patient has got fatigue and fever, and there was a sporadic case reports whereby the nasal swab was negative. That means they put the swab up the nose negative, but when they tested the brain fluid, it was positive. Again, these are, I must say, these are very rare. Guillain-Barré syndrome is even more rare. It presents with weakness in the limbs, numbness, the facial droop, autoimmune. In severe cases, there's paralysis of the breathing muscles, but this usually reverses with time. You use intravenous immuno IG, which is the preferred mode of treatment, is IVIG, right? Is your antibodies that can be used to treat. So, but COVID-19, as we all know, is usually associated with the respiratory system. Again, I want to emphasize meningoencephalitis and Guillain-Barré are reported but are rare. And ischemic strokes are probably more common than hemorrhagic, but involves a younger age group. And to put things in perspective, in all patients with strokes that come in, Studies have now shown that it is probably only less than 1% to 2%, depending on the studies where it's coming from. In Wuhan, they have reported up to 2%. In the US, it's reported as less than 1% of all patients with strokes. So COVID-19 and strokes are still only form a very small percentage, very small. Majority of COVID-19 are respiratory problems. So in summary, I want to emphasize that stroke is preventable. So please go to your local doctor and screen. And who do we want to screen? We want to screen the high-risk patients, those with TIA, the transient ischemic attack. Control your blood pressure, control your diabetes, control your cholesterol, and weight, BMI. Of course, there's lifestyle modification. You exercise to increase your HDL, the good cholesterol, right? And you have stops to smoking. I just want to remind everyone that the studies have proven that prevention is effective to prevent death and disability. 30% will die. And of those who are disabled, 50% are disabled. So we must screen, we must prevent. Thank you for your kind attention. Terima kasih.
Terima kasih telah menonton video ini. Jika kamu ingin berkonsultasi lebih lanjut dengan Profesor Chou Ning, silakan scan QR Code berikut ini. Atau kamu juga bisa klik QR link Profesor Chou Ning yang ada di deskripsi di bawah ya. Jangan lupa tinggalkan jejakmu pada video ini dengan like, comment, share, and subscribe channel tkon TV. Nyalakan lonceng notifikasinya agar kamu mendapatkan info seputar video-video menarik dari tkon TV. Oh iya, ikuti juga event webinar kita setiap minggunya pada hari Sabtu jam 1 siang. Untuk info lebih lanjut, follow akun sosial media kita, link ada di deskripsi ya. See you!